hear ye! Today we will be talking about the CASL. But not that CASL, this CASL, the Comprehensive Assessment of Spoken Language 2nd Edition. This presentation is brought to you by Kayla Bader, Gina Cruciani, and Steph Fry. The CASL is an in-depth eval of an individual's oral language skills. It measures comprehension and expression across 4 categories: lexical semantic, syntactic, supralinguistic, and pragmatic. The CASL can be used for a variety of purposes. It can answer referral questions, evaluate English competency in those who are ESL speakers, identify aspects of oral language that may be impacting an individual's classroom learning or interpersonal communication, and track improvement. However, the manual does state that data should not be used in isolation for diagnosis or treatment planning and should always be used in concert with other data for interpretation. The CASL-2 is based on the integrative language theory, which states that language reflects 2 dimensions, knowledge and performance. Together, these 2 components provide an excellent framework to evaluate spoken language. The CASL-2 is appropriate for clients ages 3 years 0 months to 21 years 11 months. The normative sample included individuals in differing geographical regions, gender, race, socioeconomic status, and parent education per the U.S. population demographics, so the CASL-2 is appropriate for many different individuals. However, individuals must be proficient in English, although there are guidelines for alternate scoring for AAE. It is appropriate for individuals with mild disabilities when the client spends the majority of their day in the general education classroom. The following is an overview of what aspects of language and cognition the CASL tests. The first part is lexical and semantic, which is knowledge and use of words and word combinations. The tests are receptive vocab, expressive vocab, antonyms, synonyms, and idiomatic language. The second category is syntactic, which is knowledge and use of grammar. The subtests are sentence expression, grammatical morphemes, sentence comprehension, and grammaticality judgment. The third category is supralinguistic, which is knowledge and use of language in which meaning is not directly available from the surface lexical and syntactic information. These subtests are non-literal language, meaning from context, inference, and double meaning. The final category is pragmatics, which is knowledge of language that is appropriate across different situational contexts, and the ability to modify language according to the social situation. The one subtest is titled Pragmatic Language. The CASL-2 is a fairly feasible assessment to administer and can be used in a variety of settings and administered to a fairly large age range. However, not all the tests can be administered to younger children. However, the CASL is very expensive. It's $559, which includes the manual, the easels, and 10 scoring forms. There is an online free scoring system. In terms of timing, each subtest takes about 5 to 10 minutes. Together, all the subtests can take 30 to 60 minutes depending on the age of the client. Each test can be administered individually, and therefore the scores can be interpreted individually, or they can be combined for an overall score. Overall, the CASL is expensive and can take a very long time to administer if you are doing all the subtests. However, the scores can be interpreted individually, so it may be useful to use certain subtests. It can be used in a variety of settings and does not require many materials. CASL had 3 normative samples, including the standardization sample, which provides the age norms for the test, a clinical validation sample, and a grade-based sample. The standardization sample included 2,394 individuals aged 3 to 21 years 11 months. The sample included those with mild disabilities, but those with severe disabilities were excluded. The clinical validation sample included 271 individuals with severe disabilities who were receiving special services. The grade-based normative sample included 1,538 students in kindergarten through 12th grade who were tested in both fall and spring semesters. The standardization sample was representative of the United States Census in terms of both gender and ethnicity. There were slightly more females included than males, which reflects the U.S. Census. The U.S. Census was also reflected in the number of individuals of each race and ethnicity that were included. The standardization sample was also representative in terms of parent education level and U.S. geographic region, although students whose parents had a bachelor's degree or higher were slightly overrepresented, and those in the Midwest were slightly underrepresented. This slide shows the gender and ethnicity breakdown of the clinical validation sample. There are more males than females, but the sample is reflective of different races and ethnicities. This slide shows the demographics of the clinical validation sample in terms of age breakdown and parent education. As you can see, there are individuals of a variety of ages and with a variety of parent education levels. Unlike most tests, the CASL does report sensitivity and specificity. However, these values change depending on where you draw the cutoff score. A cutoff score of 85 on the General Language Ability Index demonstrates a sensitivity of greater than 0.74 and a specificity of greater than 0.84. A cutoff score of 90 maximizes sensitivity at 0.86 but lowers specificity to 0.76. In general, a test has fair sensitivity and specificity if both of these values are 0.8. Therefore, the CASL demonstrates relatively fair sensitivity and specificity. The CASL test manual reports that the test has strong internal consistency, test-retest reliability, and inter-rater reliability. As you can see in this table, there are various types of reliability that were assessed. Internal consistency reliability coefficients range from 0.85 to 0.99 for the individual tests on the CASL and between 0.95 to 0.99 for index scores. 2-week test-retest reliability correlations were also high, with reliability coefficients of between 0.73 and 0.94 with a median of 0.85 for CASL-2 test scores and 0.88 to 0.96 with a median of 0.92 for index scores. Inter-rater reliability estimates in the form of intra-class correlation coefficients ranged from 0.85 to 0.97, which indicates high inter-rater reliability. The CASL also demonstrates good validity. Evidence of construct validity comes from a CASL-2 factor analysis, which supports the validity of the underlying constructs of the integrative language theory. Intercorrelation analysis suggests that it is legitimate to score and interpret the CASL-2 test separately from another. Convergent validity was established by comparing the CASL-2 to the original CASL and the CASL-2 to the OPUS, or the Oral Passage Understanding Scale, which is the companion instrument to the CASL-2. The convergent validity of the CASL-2 with these two tests was relatively high. To further demonstrate convergent validity, the CASL-2 was also compared to the OWLS-2 and to the SELF-5. The correlation coefficients found between the CASL-2 and these two tests also demonstrate high convergent validity. Delahan's Diagnostic Evaluation Checklist evaluates the psychometric properties of standardized tests to help determine whether these tests are useful in clinical practice. The CASL-2 met most of the criteria on this checklist. However, measures used in convergent validity tests were not administered to all participants, and the negative likelihood ratio was not in the intermediate range specified on the checklist. Some information was also not included in the manual, such as whether, when establishing convergent validity, the measures tested were administered by different examiners and whether examiners were blind to performance on other tests and to other participant information. The CASL-2 should be administered in a quiet, well-lit environment that is free of distractions. Be sure to have an unobstructed view of where the examinee is pointing. Prior to administration, calculate chronological age to determine the age-appropriate test. During administration of the CASL, you will need the 3 test easels in one of 2 record forms. One record form is a comprehensive record form, which includes all 14 tests across ages 3 to 21. The second record form is a preschool record form for only 10 tests used with children ages 3 to 6. Any of the 14 tests may be administered, but if administering 2 or more, follow the order in which the tests are presented within the test easels, as well as the order of the tests within each easel. During administration, read each item exactly as printed. Do not change words, emphasize words, or provide explanations. When starting the CASL, begin within age-appropriate start items for each test. Start easy, because when the child starts scoring zeros, you can be certain it is resulting from insufficient ability, not misunderstanding. Some test items need prompting, and these items will be marked with the prompt item as seen on the slide. Correct and incorrect responses for each item are listed in the test easel. Some correct responses are categorized as preferred or acceptable to describe quality of examinees' responses, although both responses are worth 1 point. When scoring the CASL-2, correct responses receive a 1, incorrect responses receive a 0, and no responses or I don't know are marked as NR and receive a 0. Changing answers is acceptable after the items are administered, and you must score the most recent answer, regardless if it is correct or not. The basal is established when a score of 1 on 4 consecutive items occurs. A score of 0 on any of the 4 first items require administration of preceding cert items in reverse until the basal is established. The ceiling is established when a score of 0 on 4 consecutive items is recorded, or when the final item of the test is reached. It is possible to obtain 4 consecutive items in reverse when establishing the basal, but this is not the ceiling. To determine the raw score, sum values of correct responses. Add the subtotals to obtain the total raw score for the test. You can also count preferred and acceptable responses. The CASL-2 also provides 6 index scores, which are calculated by adding the sums of the standard scores of each subtest. The 6 index scores include General Language Ability Index, Receptive Language Index, Expressive Language Index, Lexical and Semantic Index, Syntactic Index, and Supralinguistic Index. The CASL-2 provides standard scores, as well as descriptive ranges. Descriptive ranges translate numerical test results into natural language easily understood by parents and non-professionals. These ranges are described on the slide and are as follows: exceptional, above average, average, below average, and efficient. The CASL-2 provides percentile ranks, as well as test age and grade equivalent scores to satisfy reporting requirements of certain schools. However, these scores share the same limitations as percentile ranks because they are not equal interval measurement scales. It is important to note that a score of 0 means the examinee did not succeed on any test items, but without successful performance to anchor measurement, it is not possible to obtain a meaningful estimate of an examinee's ability. The same is true for extremely low raw scores. The next 2 slides provide a quick summary of the 14 subtests. The charts describe each test, the category, the process, the item number and format, the skill measured, and what poor performance indicates. The next 3 slides provide examples of test items from each of the 3 easels. As you will see, we administered NEVA on assessment day, the grammaticality judgment subtest from the CASL. This subtest is appropriate for children ages 5 to 21, and it measures the ability to judge the accuracy of syntax and construct grammatically correct sentences. It first requires students to fix grammatically incorrect sentences, and then it proceeds to make the task harder, and the student is asked to determine whether a sentence is produced correctly, and then to fix it if needed. As you can see, Neva performed very well on this test. She obtained a raw score of 52 and a standard score of 120. This corresponds to a percentile rank of the 91st percentile. Therefore, her performance was above average relative to age peers. In this video clip, Neva is administered the grammaticality judgment subtest starting at the age 9 marker. These are examples in which Neva is asked to fix a grammatically incorrect sentence.
Alright. He not like it. He doesn't like it. Ted wants to play with they.
Ted wants to play with them.
Mm-hmm. She can no go.
She cannot go.
This last clip shows the second half of the test in which Neva is asked to judge if a sentence is produced correctly and then to fix it if needed.
The bunch of flowers is growing beautifully. The bunch of flowers is growing beautifully.
Right.
Doctors like these kind of patients.
Right.
In conclusion, the CASL-2 is a valid, reliable instrument that gives an in-depth picture of a child's oral language skills. It can be used for a variety of purposes in a variety of settings.